Over the last week, ITV News has been exploring the dark side of cosmetic surgery. Every year, more than 150,000 Brits travel to Turkey for cut-price procedures. But for some, the plastic surgery that promises to improve their self-confidence ends up taking their lives. Shortly, we'll hear from one of our reporters who's been digging into the issue, and a surgeon will be here answering your questions. But before that, a look at some of the stories we've heard so far in our cosmetic surgery series. A warning, it contains some very distressing images.
I'd never experienced this. It's overwhelming. I wanted to die. I couldn't deal with this pain.
9 days after her surgery in Turkey, her wounds weren't healing, her body was riddled with infection, and her skin tissue was dying. She had a second procedure, using only local anaesthetic.
I felt like I was on fire, and I knew at that point then, I'm going to die. And that upsets me the most, that does, because I thought I'm never going to see my babies again.
Happy birthday to you.
This was Cadell Brown's final birthday. She died 4 days after this celebration.
He just started trying to say, you know, there's complications of surgery. And I just said, as my sister died. And he just said, I'm sorry, but yeah.
More devastating news was to come. To their horror, a coroner here told them that large parts of Cadell's organs, including her brain and heart, had been removed.
I didn't think it was allowed, but they said it's legal, they can take what they want.
I was never told there was any risks, ever.
Turkish medical staff told her she was bleeding internally and she had 3 blood transfusions. But she was still given a fit-to-fly certificate and allowed to leave hospital.
Ended up in the hospital in February with a suspected stroke. I also had some sort of convulsion in front of my kids.
Louise can only be fed through a pump directly into her digestive system now, after a Turkish surgeon removed more than 90% of her stomach.
I don't want a cake, I don't want biscuits, I don't want a big meal. I want to be able to swallow a bottle of water and not vomit. I went there and I did that thinking it was the best thing for my health and for me, and I was healthier before I got it done.
Well, some really shocking stories there, and those women aren't alone. Across the country, many more Brits have been left devastated after botched cosmetic surgery abroad, as our reporter Ellie Pitt has been uncovering. She joins me now, along with Dr. Nora Nugent, who's the Deputy Director of the British Association of Aesthetic Plastic Surgeons. Welcome to you both. Dr. Nugent, if I could firstly start with you, just tell us what was going through your mind as you were watching those reports.
Well, first of all, a lot of sympathy for those patients, particularly the family as well of the lady who died. These are obviously terrible situations to be left in, and also situations that leave patients with long-term consequences of the complication as well. So truly upsetting and shocking situations for those patients to be left in.
Ellie, truly upsetting, truly shocking. Your reflections on what you've uncovered this week?
Well, I think firstly, we've sort of hit the tip of the iceberg when it comes to some of the issues of complications that are coming from surgery abroad. But I'd just like to say, I mean, I have so much respect and I've been in awe of the women and loved ones that we've spoken to. The bravery it's taken for them to reveal such intimate and sensitive details of their physical and mental experiences post-surgery in Turkey, I can't underestimate that. And it's all with a sole aim. They tell me they just want people to know what the reality can look like from the risks that arise from this kind of procedures. And they want people to know that it's not just all about the glossy videos that you might see on social media and some incredible results. No doubt sometimes that is the case, but these are some of the consequences you can be left with.
We did ask viewers to get in touch with us to share their experiences and their thoughts, and we have been inundated with comments and views and opinions from our viewers, so we're going to go straight to them because time is always against us in these circumstances. This is the first question. Why is the UK so much more expensive than Turkey for exactly the same procedures, Dr. Nugent?
A few reasons for that. The UK is generally a more expensive country. The cost of living is higher here, which means generally everything is more expensive than in Turkey. Our healthcare costs are significantly higher, partly because we're a more expensive country, partly because we have many regulatory requirements to meet. If you are in a CQC regulated hospital or clinic, you have numerous standards to meet. Ultimately, standards aiming at protecting a patient and for high surgical standards, but these are expensive. And our medical indemnity, which is our medical insurance, is also significantly more expensive than overseas surgeons by and large.
Yeah. And Ellie, when the cost is significantly cheaper, people are, the bottom line, prepared to take the risk.
Definitely. I think people are seeing what they will consider comparative to some of the UK prices as a bargain, and they're driven partly by cost, also the way that these surgeries are being packaged to them in places like Turkey. It's a health holiday. It includes the flight, the hotel, the pickup from the airport in a swanky car. It's sold to them as these VIP packages that's all encompassing. What it doesn't involve, though, often is aftercare, pre-surgery consultation, and another big part of this is patient selection. So although they're being driven by cost by and large to Turkey, I've been hearing from surgeons I've been speaking to that some of these patients just ultimately would not be selected even by private surgeons in the UK to go forward with surgery because of things like other medical conditions, perhaps their weight, psychological assessments, that would just deem them not eligible for some of the quite extensive cosmetic surgery that they're looking for. But those kinds of regulations just aren't in place in Turkey.
Those are very, very important points. Patient selection, regardless of where the surgery is taking place, patient selection is key. It's not just understanding the surgery, that is important. It's being in the right psychological space to actually go ahead and do it. But it's also the physical side of it. This is not lunchtime surgery. It may be packaged as a holiday. It may look glossy, but it's actually real surgery, and it needs to be prepared for and looked after afterwards the same as any other surgery. Some of these procedures are very long procedures. They can take 6 hours. And if you have any health concerns, that adds to your risk. No surgery is risk-free. Doesn't matter who's operating or where. There are complications associated with any surgery. Yeah. They should all be gone over in advance in the consultations. And if someone's risks are high, I'm just going to give a few examples. For example, if you are diabetic and your blood sugars are not well controlled, well, that should be dealt with first and then have the surgery at when things are at a safer level. Or if you're considering 2 surgeries, maybe you're not suitable to have them both together, you know, if you're considering 2 different areas. If someone's heavily overweight, and this is not for bariatric surgery, this is for cosmetic surgery, plastic surgery, if someone's significantly overweight, that puts their risk of healing problems up as well. And not only does it put their risks up, their results are not as good either. It's not meant to be weight loss surgery. It's meant to be contouring or shape enhancement surgery, not to get rid of excess weight. Okay,
let's move on to our next viewer question. We always talk about Turkey, but how many botched cosmetic surgeries are there in the UK?
So it's the difference, I guess, I'm going to be slightly pedantic, but it's important. There's a difference between having a complication and having something botched. Yes. Because the best surgeon and the best surgical procedure in the world can still have a complication. It's how it's looked after afterwards, that's, you know, how it's explained beforehand and looked after afterwards, that's what makes the difference to the patient and how the patient's prepared and selected for surgery. A botched surgery is where something's been done wrong or not done enough. And the truth is we don't have an all-encompassing figure for the UK. We still, you know, we are involved as an organisation in BOPS in the UK pushing patient safety as well and surgeon trying to make sure patients know what to look for in a surgeon. So complications do arise in the UK. We have a problem in the aesthetics side of things with underqualified practitioners performing procedures here too. So it isn't exclusive to overseas, but at least you don't have the overseas travel component to access aftercare or to get back to contend with. I can't give you a precise number, I don't think anyone can, but I would say it is a problem in most countries that haven't completely controlled specialisation and registration and regulation of cosmetic surgery and aesthetics. We do see it here, but we can tell patients here what to look for in terms of surgeon qualifications, clinic regulation, clinic registration, what they should expect in terms of consultations beforehand, aftercare afterwards. And it's also important that a patient knows the individual terms and conditions or contract of their treatment as well.
Ellie, you spend a lot of time with Sarah, for example. You know, from what you understand and from what, you know, the conversations that you had with her, How much clarity does she have in terms of, what Dr. Nugent has just articulated to us there?
I think the pre-surgery consultation, the awareness of particularly the risks that are involved in the surgery isn't always stressed, shall we say, depending on your clinician in Turkey. A lot of it is to do with selling the dream, the results, the post-surgery images, and those kind of risks and potential complications at any scale aren't always sufficiently explained to the patient beforehand. I think it is important to say that there are, of course, many excellent surgeons in Turkey, and surgeons in the UK I've spoken to say that many of them also perform the same procedure so regularly they become experts in that particular domain. But of course, when things go wrong, they can go very drastically wrong.
Yes. Well, that point there leads us nicely to the next viewer question. Is there a difference in the medical qualifications needed to carry out these procedures in Turkey compared to the UK?
There is a standard in Turkey that a specialist plastic surgeon needs to meet, but it is different to the UK. We have a set training in plastic surgery, and for someone who trains and works in the UK, by and large, we have surgeons coming in from overseas as well. There's a training program, an exit exam, and essentially a qualification in plastic surgery and a specialist registration with the medical council. There are equivalent qualifications in Turkey. They're not exactly the same. But what patients should realise about overseas travel is that not all countries have the same training programs or the same specialised qualifications for plastic surgery. Every country is slightly different. Some countries don't have an exit exam. Some countries don't have a formal training program. There is a European-wide exam, but individual country exams can be a higher or a lower standard to that EBOPRAS European exam. So one of the problems is not that all surgeons overseas are bad. There are world-renowned surgeons and excellent surgeons, but one of the problems is it's hard to know, are you getting one of those surgeons or not? How do you know that's your surgeon? How do you know you have a reputable surgeon? How can you check it?
Yeah, when online, people are able to delete negative reviews, people are able to make sure that their branding and their content all looks completely professional and it draws you in. It's really difficult, I think, when we're asking people to make sure they do their research, make sure they do their homework, when actually that content online is really hard to cut through.
It's curated and it's marketing content. It's not necessarily a list of someone's qualifications, and even if it was, how do you know those are the right ones? There are specific qualifications for each country, but if you're travelling not knowing what to check, you have no idea whether your surgeon has those or not.
I will say the Turkish embassy does have a search function through its website where you can look up hospitals and clinics, and that's a sense of reputable sources of information.
We have contacted our Turkish counterparts, the Turkish Society of Plastic and Reconstructive Surgery, and they have given us an outline of what a reputable Turkish surgeon and clinic should. I'm saying Turkey because that's the most common location for UK patients. But they have given us an outline, and actually we have put it on our website because so many patients travel, about what to actually look for that will tell you this is a reputable surgeon, a properly trained surgeon, this is a reputable clinic, what kind of things to look for. And some overlap with what we've talked about earlier.
Well, that is the next question, Dr. Nugent. Quite a few people have been getting in touch to say, in the main, their experiences in Turkey has been a positive one, but it seems this is somewhat of a lottery. How can you tell if the clinic is reputable?
So I'm just for a moment going to say that we have put a guide on the BOP's website where we have specifically asked the Turkish Society to list out things like that, and it's things like making sure their surgeon is a specialist in plastic surgery, the number of years of experience they have, that the clinic is registered with the Turkish Health Ministry. So there are things like that to check. But I would also say complications can happen with any surgery and any clinic and any surgeon, reputable or not. So it's also about thinking about how you would access aftercare and what you would do if a complication happened and you've come back home. So it is the qualifications, but it isn't just the qualifications.
On the matter of compensation, on the matter of funding and cost, this last question, what should someone do if they want to seek compensation for surgery that has gone wrong?
Okay, so this is after the fact, so they've already signed up for it and had a complication. I think number one, check all the paperwork, and on that point for paperwork, it should be in a language that you understand. You know, if you don't speak the language, how can you properly sign something?
Sure.
So all the terms and conditions of treatment, so you know what was agreed in advance that will be covered or not. First port of call will be to contact the clinic or surgeon directly, because they were the clinic or person that you had your agreement and your arrangement with to carry out surgery, and that you trusted to carry out your surgery and look after you afterwards. That's the first port of call. And some patients have got some satisfaction out of that route. Not everybody has, and some people don't have a good way of contacting the surgeon or the clinic. And then it boils down to honestly looking to see can if they want to take it further legally. But you're in a different jurisdiction, so that's difficult.
Ellie, let's stay on the subject of money. I mean, I'm sure you've been exploring, I guess, the ethical questions about who foots the bill when a procedure goes wrong. You know, is it the patient? Is it insurance? Do we now need to review the model that currently exists?
This is a massive question, because what we've been seeing, particularly with Sarah Platt from Wales, who I spoke to, is that when she's come home and had surgeries on the NHS, it's the taxpayer that is footing that bill at the moment, and that bill can run into, if you're having multiple procedures, tens if not hundreds of thousands of pounds. Look, not many people want to confront the central question of the NHS, the core principle, which is, of course, that treatment is free at the point of use for anybody who needs it. That is something that most people want to keep, but there are big questions. Should the patient be footing the bill for treatment if they need it back in the UK? Can insurers step in? Maybe, if they have valid insurance. There are questions now about whether Turkish authorities or indeed the clinics themselves should be contacted by the UK government or NHS and chased for the cash. Very challenging diplomatic questions there, but certainly I think that if this problem increases or continues, are going to have to be confronted by the Labour government.
Dr. Nugent?
I think it's a very emotive question, both for the taxpayer and the patient involved, because the patient involved has an acute problem, something's gone wrong. They may actually be acutely ill. Some patients have needed intensive care for a period of time after their return. So you have an acute medical problem, you have a distressed patient, and you know, it is very difficult to say, no, you don't deserve treatment if there's a wound infection or so on. So that generally does get treated, but it's not, although no one's handing over payment at that point of contact, it's not free treatment. It is a cost to the NHS and therefore the UK taxpayer. By and large, at the moment, it's emergency and acute care is being covered, but corrective for surgery for scars and shape and other aspects are not. We have broached the insurance issue. The difficulty is it's very difficult to get an insurance company to cover this sort of care. It's not an easy task to get a broker or an underwriter to take on this. We have also, as an organisation, brought this up with the Department of Health and Social Care, and they are aware of the issue and the scale of problem that we're seeing across the country.
I guess it's also the issue about bed space as well.
It's an additional strain on an already strained system, you know. So individually, these patients are very deserving of treatment. They have an acute problem, but in terms of a system and a resource, it is another strain and cost on an already strained and underfunded resource.
Ellie, you've been living and breathing this story for a long time now. Just a final thought from you, your thoughts, your reflections on what you've seen, what you've heard.
I think it's been understood for some time that overseas surgery comes with risk, and we've seen Turkey be singled out for a number of years. We know that 28 British patients have died there from surgery since 2019. That's been known. What I think we're really starting to see now, and we're sort of teasing out in our reporting, is the impact that it has back home, both on the NHS but also the individuals and their families, when they may have returned home, but they're now living with lifelong and life-changing injuries and consequences from the surgery that's gone wrong.
And Dr. Nugent, if there was one key pearl of advice that you would offer our viewers, what would it be as they are considering taking on one of these procedures?
Do not commit to it until you have the full information, and that includes time to discuss the risks and the aftercare before committing to the surgery, and really consider whether it's the best option to go overseas or not for you. It comes at a high price if it goes wrong.
Yeah, okay. Dr. Nora Nugent and Ellie Pitt, appreciate your time. Thank you both. Thank you.
Thank you.
Well, that is all from us for now. If you've been affected by the issues raised in any of our cosmetic surgery reporting, you can find advice and help on our website, itv.com/news. For now, many thanks indeed for watching. Bye-bye.